Hi friends, I am Professor Manokar from Chennai. Today I am here to discuss with you about the impact of COVID-19 and in patients with diabetes. So if at all I put a simple jargon, diabetes and COVID-19 are made for each other villains. That is, COVID-19 patients, if they are diabetic, then it is more likely that these people are more likely to get the infection as compared to other people. Number two, they are more likely to develop complications. Number three, they are more likely to die. Obviously, that's one of the commonest comorbidities associated with mortality. And fourth important, the recovery is more likely to be more prolonged in patients who are diabetic when they develop a COVID infection. So if you are diabetic, how do you avoid a COVID infection? Very simple. Whatever is preached in the press, media, everything, make it double. So whatever precautions are advised for other people, just make it double. So if there is anybody leaving the home for essentials, it is not you, it is somebody else. So make all the precautions double. Whatever precautions you are advised, please follow them. But in simple things, if somebody says social distancing of 6 meters, make it 10 meters. Just make it double. So that's the easiest way you can avoid a COVID infection. God forbid, if you develop a COVID infection, we advise all diabetic people to follow what we call as the sick day rules. What is sick day rules? Number one, take your temperature daily, morning, night. Check your weight. That's a very important aspect in a diabetic patient. Check your sugars as frequently as it is feasible. It could be twice a day if you are insulin dependent, at least once in a week if you are non-insulin dependent type 2 diabetes patient. And make sure that you take lots and lots of fluids. Unless you have established heart failure or kidney failure, please make sure that you take a lot of fluids and never miss out on taking lots of fluids in the presence of infection. And what are the signs to look out for? Look for increasing thirst, look out for some vague symptoms like abdominal pain, malaise, fatigue, or excessive drowsiness, or increasing urination. All these things are a harbinger of trouble. So if you have the slightest change from your routine, please take medical help. Coming to drugs, please understand, if you are having a fever or an infection, you should never stop your diabetic drugs unless you are having vomiting and no oral intake. Otherwise, please continue to take all your diabetic medicines, whether it is tablets, insulin, or anything. Number two, don't stop any antihypertensive drug, especially because there is a lot of concern about ACE inhibitors and ARB group of drugs which are commonly prescribed in diabetics. Please don't stop any of these drugs. Please continue to take these drugs and continue to take other medications for heart disease if you have been prescribed anything. Last but not the least, stay safe, stay at home, and save yourselves. Thank you.